Welcome to our media messaging workshop, which is an overview of the California Department of Public Health Substance Use and Overdose Prevention Initiative's resources and social media toolkits. We're so delighted to have Liz Hires and Milani Yalenko. Liz is the prevention coordinator at the California Department of Public Health, and Milani is the communications specialist. On that note, again, Liz, take it away. Thank you so much again for joining us.
All right, thank you, Joe. Thanks for having us. And thanks for doing introductions on our behalf. Now we don't have to do that. I just want to mention that I will be doing the first part of the presentation, about like 10, 12 slides, and then Milana is going to take it from there and go into more of the Facts Fight Fentanyl media campaign that we recently released. All right, welcome everybody. I'm going to go over our Overdose Prevention Initiative here at the California Department of Public Health. The Overdose Prevention Initiative, or OPI, was formed in 2014 when prescription opioid overdoses and deaths were increasing drastically in California and throughout the US, as you all may remember. It was originally the Opioid Prevention Initiative, but we started to see polysubstance use like opioids and stimulants really driving overdose deaths. So we widened our prevention efforts to include these substances. OPI addresses the drug overdose epidemic through a multi-pronged collaboration at the state level, incorporating surveillance, research, and prevention. And listed here are program goals that drive our work that I'll go over in more depth in the next slides. All right, we have a dedicated data and surveillance team that collects several types of overdose data, including emergency department, hospitalization, prescription, and death certificate data. We collect and share these data to the public on two websites that I've linked here. The Overdose Prevention Initiative data page has a lot of published data reports for the public to read and review. And the California Overdose Surveillance Dashboard is an interactive data tool that integrates non-fatal and fatal opioid-related overdose data and opioid prescription data. You can create California statewide and county-level data visuals like charts and graphs. Some of you might have even used the dashboard in your work already. Counts and age-adjusted rates for overdoses are listed by demographic attributes such as race and ethnicity, sex, age, and also by county and at the zip code level. We have another surveillance system that captures fatal drug overdoses called the statewide unintentional drug overdose reporting system. So this is for unintentional overdoses. We also call this SUDERS as an acronym. SUDERS analyzes data from death certificates, autopsies, toxicology reports, and coroner investigative narratives and pulls specific de-identified data into a national database. Our research scientists gather a lot of information from these reports, including standard demographics, mental health history, drug use history, and positive toxicology findings. Basically, this information really helps us understand the circumstances around drug overdose deaths. And we call this type of work abstracting data. And it's actually, I've done a little bit of it before, and it can be very overwhelming because you're reviewing the circumstances behind individuals' overdose deaths. And some of these are really young individuals, youth. It can just be really, kind of really sad. It's very sad and emotional to read these and have to pull out data. All right. Here is, I'm a very visual person, so I thought this might be helpful for you all. This is a screenshot of our surveillance dashboard. This is what the website looks like when you first go to it. And as you can see on the left side here, you can go to the California dashboard or the county dashboard and choose San Diego. There's quick stats at the top here. And then there's information about what data is available so they keep it up to date. And currently we have preliminary 2023 death data and full year prescription data and other data. We are still waiting on the final full year death data for 2023. Once we have that, we'll be able to analyze that information. And here's also a snapshot of the SUDERS system. So this just is how we collect, not how we collect, how we input the data here. So just wanted you to kind of see how that works. It's just a very typical looking data collection system. Okay, and so now I'm going to go into some current overdose data trends. Again, we don't have full 2023 final death data yet, so I'm going to cite some 2022 data here. So this line graph shows the drug overdose death time trend in California from 2007 to 2023. As you can see, 2019 to 2022 has the most significant increase in all drug-related overdose deaths, with an increase of 76.9%. In 2022, there were over 11,000 all drug-related overdose deaths, which is only a 1% increase from 2021. And the majority of these drug-related overdose deaths involved an opioid. And of these deaths in 2022, fentanyl contributed to the majority, 87.7%. Very significant. Okay. Our program also funds the California Department of Justice to operate and maintain California's prescription drug monitoring program called CURES. The CURES database contains information about Schedule 2, 3, and 4 controlled substance prescriptions dispensed to patients. These data are reported by clinicians and pharmacists that dispense these medications. Clinicians and prescribers use CURES to review a patient's prescription history before prescribing a controlled substance, such as when prescribing treatment for opioid use disorder. And also, law enforcement and regulatory agencies can use the data in their efforts to control the diversion and substance use of these controlled substances. And also the data can be used for analysis, education, and research as well. Oh, just a note, we receive funding from CDC for an overdose data to action grant. So on the left here, I have just the flow of the funding. We receive CDC funding, and then we provide that funding to the Department of Justice. All right, we also have an amazing partner called California Bridge that you all are probably familiar with, hopefully, because they're amazing. If not, here's an overview. They focus their work in emergency departments to advance treatment for a substance use disorder, and they use, very importantly, a harm reduction perspective that emphasizes rapid patient-centered care. We provide them just a small amount of funding to help expand their clinical capacity to screen, diagnose, and support patients with substance use disorder. We also provide them funding to support their substance use navigators. Now, these navigators work directly with patients in emergency departments to connect them to treatment right away while they're in the hospital. And they also link these patients to outpatient treatment resources and wraparound services. The navigator role is extremely important. They often have lived experience themselves, and so they're able to connect with these patients and understand what they're going through. Often the patients don't trust doctors or the hospital system in general. And so navigators are able to really gain their trust and support them into getting treatment. And they also follow up with them as well to make sure that they're continuing treatment outside of the hospital. Next, Distro California, also amazing partner. They are a mail-based harm reduction service to reduce opioid overdose, overdose deaths, prevent injection-related disease transmission, and improve the lives of people who use drugs. We fund their California program to expand their harm reduction services, and they increase their community-based linkages to care as well. The program specifically aims to reach people that have no access to a syringe services program, or those that might be geographically isolated, such as living in rural areas, or those who are just unaware of the availability of services. They also use navigators to link people to care and other services, such as community-based organizations and treatment programs as well. Our overdose response strategy project fosters partnerships between public health and public safety agencies to address the overdose epidemic. They share data systems to inform community overdose prevention efforts, support evidence-based overdose response efforts, and design and use promising strategies at the intersection of public health and public safety. And they also share widely information that supports the implementation of prevention strategies that can reduce substance use and overdose. And currently, what they're focusing on this year is outreach to jails, tribes, and youth serving organizations specifically. And then next year, we're going to build upon what we've learned this year in doing our outreach and develop plans and goals that on some new focus areas. Okay, and here's a little bit of some local work that we have. Our fentanyl overdose prevention grant was established by Assembly Bill 2365. This is a 3-year grant, and the legislation established the parameters of the program. The goal is to increase local efforts related to education, testing, recovery, and support services. And there's also a focus on closing gaps related to access to care and services to reduce health inequities for populations that are at the greatest risk for overdose. And these 6 one-time grants are allocated by region, 2 in Northern California, 2 in Central Valley, and 2 in Southern California. That was also legislatively mandated as well. And I have the grantees listed here. And we'll be sharing the slides. Joe, I'll email you an updated version because I've added a couple more, so you can feel free to review. All right, our statewide overdose safety work group formed in 2014 when the OPI program was created. The main goal is to unify California's response to the drug overdose crisis. The work group members include subject matter experts from various state partners that work on overdose prevention efforts in their respective programs. So we have members from CDPH, of course, Department of Healthcare Services, Covered California, Department of Social Services. We have some from Emergency Medical Services Administration, and then there's more members as well, but just giving you a sense of the types of members that are involved. And the goals are to improve coordination and information sharing, implement cross-cutting strategies to address overdose, and ultimately reduce fatal overdoses. We established 3 subgroups listed here: harm reduction, upstream prevention, and public safety. And the subgroups have their own focused work plans that help drive the work. We have several statewide naloxone access policies and programs. The OPI, my program, maintains the statewide standing order for naloxone, which is signed by our CDPH director and state health officer. This order was first signed in 2018, and it's a non-patient specific prescription that allows people to give naloxone to individuals who may be at risk of opioid overdose, and also to their family and friends, or anyone who might be in the event that they need to respond to an overdose. And some common types of organizations that apply for the standing order are schools, police departments, fire departments, and nonprofit organizations. However, really great news, as you all probably are aware, over-the-counter naloxone is available and has been available for a little bit over a year now. It was July 2023 that the FDA allowed 2 different formulas to be over-the-counter, and that was Narcan and Revive at that time. And so this is making naloxone more widely available and accessible to the public, which is fantastic. Also worth noting that while CDPH provides a standing order, which is still required for some formulas of naloxone, by the way, but just not the ones that have been approved for over-the-counter, DHCS, Department of Healthcare Services, is a state agency that supplies free naloxone through their naloxone distribution project. And they also provide fentanyl test strips. And I think that was my last slide. There's also some resources listed here on the right that you all can review later. Okay, Mylana, take it away.
Thank you, Liz. Hi, everyone. So today I'm going to be going over the Facts Fight Fentanyl campaign, which is the new statewide campaign to combat the opioid crisis, and it launched on August 29th and runs until June 2025. Next slide, please. All right, so before I get into details of the campaign and sharing the assets, I kind of wanted to give some background on the campaign. And prior to creating it, we conducted formative research to refine a campaign strategy. This was followed by a creative concept testing to gauge which campaign concepts was most effective and also which ensured that the content and delivery of the message would be effective. And from our research, we learned that people really wanted more information. They wanted more facts. Learning about the problem of fentanyl, even though it was scary, people felt like it was more approachable once they learned what they can do about it. And overall, the knowledge of naloxone was low, and it was often associated with misperceptions, um, for instance, related to difficulty of administering naloxone, as well as concerns regarding the safety of naloxone, whether it would hurt the person that they were administering it to, if it was addictive, and concerns similar to those. We also saw issues related to stigma. There was a perception of basically two different roles of drug use. One was social drugs, and the other was hard drugs. And while social drugs were approached with a bit more empathy, there was more stigma surrounding hard drug use. And people were more ready to associate social drugs with their social groups, like friends, whereas hard drugs, um, were more associated with like fentanyl use and uh, being used by people who are not part of their social group. Next slide, please. All right, so after research and creative testing, we move forward with the Facts Fight Fentanyl concept. Um, its goal is to increase awareness of illicit fentanyl, naloxone, and how to respond to an overdose event. Our audience for this campaign are those between 16 to 39-year-olds in California. But the way that media buy is divided by age range, it actually reaches people up to 44 or 46 years old. And the languages that are included in this campaign are English, Spanish, Korean, and Mandarin. And our priority populations are the Black and African American communities, American Indian and Alaska Native communities, Asian communities, Hispanic and Latino communities, LGBTQIA, and the white communities. Um, these are priority populations for different reasons, and we tried to tailor the campaigns based on what we found in formative research and creative concept testing. And so the ads that were created for this campaign are going to be shared in out of home and digital ads like billboards, bus stops. If you're ever at a checkout counter at a store, you might see like an ad on the credit card machines. So it'll be on those. It's going to be included in streaming TV like Hulu as well as cinemas. And also paid searches like keyword searches on Google. And of course, social media like Instagram, Facebook, Snapchat, and TikTok, as well as digital video, audio, like YouTube, Spotify, um, Pandora. And in addition to the ads, we also have the accompanying website, factsfightfentanyl.org. If we could move forward, please. So this is a screenshot of the landing page of factsfightfentanyl.org, and it's available in Spanish, simplified Chinese, and Korean. And on this website, people can get information about facts on fentanyl, naloxone, and it also has a link to the naloxone finder map. And it includes illustrations on how to recognize an overdose and a video on how to administer naloxone. People can navigate the website using the buttons, or they could just keep scrolling because it's all on one page. So it kind of mimics how people use social media. People kind of just keep scrolling down and getting the information that they need. And it also has information on fentanyl test strips and more. Next slide, please. All right, so in addition to the paid ads that are seen on social media, we also have what we call organic social media content. So this content shows up on the California Department of Public Health social platforms. So our Instagram accounts, Facebook accounts, um, and X, formerly known as Twitter. Um, in addition to the findings from formative research and concept testing, there were additional considerations that we used when creating this content. So the first one is using social language. So this is a very serious topic, and we want to keep people engaged. And on social media, that means using a more casual tone and even like trends or memes that are popular with the audiences that are on the platform. Um, we also didn't want to push CDPH into categories that didn't feel authentic. So authenticity was definitely another one of the considerations. Um, Finding a tone that worked for CDPH and the campaign was very important. And lastly, of course, following the social media platform guidance. Every platform is different. What works on X might not work on Instagram. So, following the best practices for each platform really allowed us to have or to maximize the reach on each one of them. Next slide, please. All right, so some of the formats that we use on for the organic social content are static image carousels. So these are pictures, and there's multiple pictures in one post, so people can swipe through them. We also use animations and GIFs. This was really important because animated things just get more attention on social media. We're also utilizing Instagram stories and reels for videos. Like I said, we're using memes as well as videos created by content creators. Next slide, please. Some of the topics that we cover on social media are fentanyl and naloxone information, where to find and how to administer naloxone, signs and how to respond to an overdose, and we're going to have information on the Good Samaritan law as well as personal stories. And the personal stories also kind of extend to what I'm going to talk about on the next slide, which is collaborations with influencers. Next slide, please. All right, so influencers are going to be posting content on their own social media platforms. So previously it was the CDPH platforms. For these collaborators, they're going to be posting it to their own audience. So that kind of expands our reach in that way. And our collaborators are divided into three categories. We have those who are relatable, those who are vocal, and those who are credible. Relatable influencers typically have lifestyles or interests with closer proximity to casual use of drugs. So, like DJs, people who attend music festivals, and people who post mental health content. Um, Vocal influencers are those who are more trusted to speak on topics that are a bit more serious in nature, and may even be more sensitive, even though it's not particularly around like drug use or fentanyl. And then credible influencers are those who are able to speak to the topic of like fentanyl risks, safety, harm reduction, and have maybe more authority than the two previous categories. Additionally, we're also working with an EDM artist called Elenium. We've had a pretty successful partnership with him. His audience has been really receptive to the content that we're putting out, and it helps that he's super passionate about the issue. One of the things that we considered when looking for someone to partner with is that they are passionate about the topic, supportive of the campaign, and over like having a big reach, they're someone who really engages with their audience. Even though having a big reach is important, if their audience is not actively engaged with them, there's questions about like if they're able to influence their followers, or the audience that they have. And just to share a little bit of the campaign assets that we have, I'm going to play the video. It's about 15 seconds. He recorded multiple videos for us.
If I was doing what I did today with the prevalence of fentanyl, I would 100% not be here. I would be dead, and there's not a doubt in my mind about that. I think it's that big of a threat, and it's just not forgiving. For the EDM community, I would love for us all to really welcome the education behind really understanding the threat of fentanyl right now, and the threat of potentially having it in a ton of drugs. Going to a concert, if you're experimenting with anything, it is a danger. It can be cut in anything, and it can be lethal in the smallest dose. And I think everyone just needs to be educated on the threat of that and what you could potentially do to save someone's life.
All right, so that was one of the videos we had with Elenium. Liz, if you could go forward, please. All right, so this slide is a high-level overview of the PR activities that we'll be conducting for the campaign. So this is earned media like newspaper, broadcast interviews. During phase one, that was really the launch of our campaign. We had a media briefing the day before where we invited the media for a preview of the assets and to do interviews with Dr. Aragon and other CDPH spokespeople, as well as spokespeople from our local partners. What this did was really create kind of a buzz the day before launch, and it ensured that we had coverage of the campaign. And then for phases 2 and 3, we're going to be doing earned media interviews as well as op-eds, especially around Fentanyl Awareness Day and the festival season. So when it comes to earned media, using awareness days or days that are relevant to the topic can be a really good hook to get the message out about fentanyl in the lock zone as well as that campaign. And for all of the interviews and op-eds, we like to include relevant data. When you include data or refer to a report, this is something that reporters really like to include, and that gets their attention. And we also offer interviews with the CDPH spokespeople as well as local partners to elevate their work. Reporters also really like having people to interview. So if you have partners or people with lived experience that you can offer up for interviews, it'll also more likely be picked up by reporters. And next slide, please. So before I share some of the assets that we have, I just like to share some of the toolkits that our partners are able to utilize. So this slide contains a screenshot of the Facts Fight Fentanyl toolkit. We have images and suggested caption copies for social media. And it's still something we're building out. So we're going to have more content on here as well. And then on the right are other toolkits that can also be co-branded and used by community-based organizations, local health jurisdictions, our local partners. And yeah, so both of these toolkits can be co-branded. And there's also, if you're able to click on the link when we share the slide, there's going to be an email on there. So if there's any interest in like co-branding anything, you could reach out. And depending on the requests, we might be able to work with you on that. So next slide, please. All right, so this slide shows a sample of the static ads that we have. So we have them in English, Spanish, simplified Chinese, and Korean. For the Spanish market, we actually have Spanish and then English and Spanish bilingual ads. So the ones that are on here, it's the Spanish and English bilingual ad. And then next slide, please. All right, so I also included a sample video. Liz, if you press next, I think it'll play.
If this fire is a fentanyl overdose, naloxone is the extinguisher that stops it cold. We can all become informed humans and help save lives at factsfightfentanyl.org.
All right, so that was the 15-second version of the ad.
If this fire is a fentanyl overdose, naloxone is the extinguisher that stops it cold. We can all become informed humans and help save lives at factsfightfentanyl.org.
Thanks, Liz. We also have the 30-second version of the ads. And then for social media, we also have different dimensions, like I think it's like 9 by 16 and 1 by 1 sizes. And that way we're able to use all the assets that we have and really make more use out of them by making them shareable on social media. And that concludes the Facts Fight Fentanyl campaign. Thank you.